A service like this takes a lot of time and effort to set up, but it has to be the way forward to break down barriers and also to break down the time to diagnosis, to try and improve outcomes for patients with cancer and significant non-cancer diagnosis. It's invaluable. Unfortunately, due to the stresses within the system, dialogue between primary and secondary care has broken down. With this service, due to the promptness of the service, patients are seen within a week. The GP gets full letter and information within 24 hours, and there is a named point of contact in the RDC manager and indeed the consultant radiologist and physician that generally staff the clinic. It's in our local hospital, which also makes a big difference within the communication pathways.
Yeah, I think this has been an exemplar of how the interface between primary care and secondary care should actually work. This has worked very well. We've had good referrals in with patients having made specific diagnosis where the primary care clinician has had struggled to make a diagnosis but has that nagging feeling that this patient's got something significantly wrong with them, and that we've been able to make that a rapid diagnosis and ensure that that patient has had beneficial, good quality onward care. I think from the primary care perspective, the GPs get a rapid answer to patient that's worrying them, the patient they think that might have cancer, and is able to put them either at ease or give them a rapid diagnosis so that then the patient has onward investigations and onward treatment. We've made diagnoses of cancers, and certainly we've had a patient who's had surgical treatment after the diagnosis of their cancer within a week of having been seen here in the Rapid Diagnostic Centre. So having been seen, scanned, worked up with appropriate investigations and had surgical and therapeutic treatment. With the patient presenting, they had non-specific symptoms and did not give any significant clues to the site of their cancer, and could have had several months of going back and forth, having piecemeal investigations, having perhaps an ultrasound scan 1 month and perhaps a different test to look at their colon or something the next month, and perhaps having a CT scan another month. So you'd be doing that in a very linear fashion and not in a holistic one-stop shop manner. So this patient benefited significantly.